On the first movement, we're just going to do an afterward stroke. I'm going to place one hand over the muscle and my other hand is going to support the top of that hand to apply pressure, and I'm just going to run up from the lower back to just under the shoulder blade. Now we're working on this section of muscle here. You should feel it underneath your fingertips. So the pressure is applied through the fingertips onto that muscle. Nice even pressure the whole way up. You shouldn't be on the spine, you should be just off the side of the spine onto the muscle. So nice firm even pressure. And you can do this stroke as many times as you feel like. Somewhere between 10 and 20 times is always a good number. So again, keep it nice and slow, nice and steady. We're looking to relax the muscles, so the action is always slow. Trying to work into the muscle fibres. Okay, so that's the first action we should do. Again, I'll just show you without that supporting hand on top, so you can get an idea on where my fingers are running. So here you can see the muscle that I'm trying to work on, and we're just applying those fingers over the top. And I'm feeling my way using the tips of my finger. I can feel my way over that muscle, not letting it slip off this way or that way. Again, the supporting hand helps with that, helps to apply pressure, and it helps to guide it in the right direction. So again, it's quite effortless. It shouldn't feel hard work to do this. I'm using my body weight over the top of my arms, and that puts the pressure through the muscle. Okay, so after you've done that, you repeat it on the other side. Again, 10 to 20 movements is a nice number. The next movement we're going to do is we're just going to work on both sides at the same time. I'm going to use my thumbs, just again holding onto the sides as a guide using my fingers, and then I'm just working up those same muscles using the thumb pressure on each side. So it's a similar action to before, but we're working the muscles slightly differently because it's just one thumb. It'll feel slightly, probably more pressure to the patient. Again, I'm using my body weight transferred through my arms, so you shouldn't have to push hard with the arms. We can adapt this stroke a little bit by adding small rotations in. So as you work up the muscles, we're going to rotate the thumbs round and round as they go up. So again, remember, we're just working in this section here. So again, when we come down here, we can feel we're on to the top of the pelvis. We don't want to work onto that bony section. So as soon as it drops off, we fill that gap, feel the muscles start, and we're working round and round on those muscles. Again, applying sort of firm pressure, but even, right the way up until we see here the shoulder blades are starting up here, but the ribs coming down. We don't want to work harshly over those ribs. So as soon as we can feel that, then just ease off. So in this one we've got the two movements. We can adopt the two together. You can run up the muscles if you feel tension, stop, and apply some circular actions to try and increase the mobility of those muscles, increase the blood flow, and then carry on working up. So that's action number 2. On to number 3, and we're just going to work off the sides here onto these muscles down on the side of the lower back. And what we're going to do here, again, we're going to use, the pressure is on the thumbs, so the fingers on this side aren't doing any work as such, so they're just to guide and steady the hand. So we're just going to work down, and we're just alternating one hand then the other. And again, we're feeling for, if we look on this side, we've got the top of the pelvis, we can feel the bone here, we've got the bottom of the ribs, and in between is where we want to hit. So we're working down into that section there. So again, I'm on this side, so I'm using my thumb down into the section and then over to the other one. And you're just repeating one after the other. again, you should be able to feel any tension that's in these muscles. It will feel slightly harder, more firm under your finger or thumb. And again, you just want to do 10 to 20. See how it feels for the patient. Ask if it's a nice experience for them, whether it's helping, whether it's hitting the right spots. And keep working it. You don't want to overwork it, you know, you don't want to be doing this for sort of 5 minutes, but without changing on a different stroke. So again, after I've done this one side, I would do the same on the other side, but I'd come round and use my thumb again in the same action that I've just done. Our fourth movement we're going to do, we're just going to apply pressure along the same set of muscles and work down the muscle, applying pressure as we go. So we're just going to again use our thumbs. We're going to put one thumb and then the other one on top just to help with the pressure. As you can see here, this is the muscle, so it's quite well identified on this patient, and I'm just going to apply pressure. It may take you a little experience, so you may apply the pressure and perhaps it's not enough, so you have to push a little bit harder. So you need to talk to the patient and see how it feels. But you don't want to apply too much in one go. And then hold that pressure for about 20 seconds. And then just gently release, come down about an inch, and again apply the same pressure again. So again, it's through my thumb that I'm working. As you can see, my thumb wants to bounce off either side. It wants to slide off. So I use my other hand to stabilize it and add more pressure through the thumb. It stops then. This hand is preventing the thumb, and it's helping that muscle stay in position. So again, I'm just holding that for 20 to 30 seconds. You want to apply even pressure. Don't sort of change the pressure once you've set it in. Hold the same pressure, because then the muscle will give it a chance to ease underneath your thumb. And gently relax. Always gently come off the pressure. Don't do it suddenly, otherwise it's too much of a shock to the muscle. So again, I've come down an inch. I'm going to apply that pressure, put my other hand to stabilize, and press in again. Now it depends how long someone's back is as to how many of these you need to work down the entire range of the back. On this patient it looks like 3 is going to be ideal. So again, I'm just holding that pressure point. Again, this may feel slightly uncomfortable for the patient, but here the idea of this massage is that we want to create some relief to those muscles. We want to relieve the tension in them. It's not necessarily about a soothing, relaxing massage. This is to get some benefit and release some pain. So again, I'm just going to relax there, and actually on this patient I could feel that relax when I did those 3 pressure points on those muscles. By the time I got to the last one, I could feel the muscle had begun to relax. So I'm just going to go back to the beginning, and we're just going to run up again the muscle. So again, we're coming off the top of the pelvis into that valley, and we're just applying the pressure with the fingertips up to where the ribs are starting. So again, it's all about feel, really. You need to feel what's underneath your fingers and work the muscles. Don't work on the bones, work on the muscles. So our second one was applying the pressure with the thumbs. So again, you can come round in little circles all the way up. Again, remember, you don't have to always work up. So for example, if I came down here and I felt this was a particular area of tension, I can just stay here and work away in these little circles, applying the pressure to the areas that need it. Again, talk to the patient, see how they feel. Generally speaking, if they feel like it's quite painful, then it's probably the spots you need to work. So it's a little bit unfortunate it works that way, but that's just the way it is. So after I've done those, I'll come on to the third movement, which again is coming off from the centre into that valley down the side, in between the top of the pelvis and the bottom of the ribs. Again, just keep working one hand over the other. Use your body, don't use your arms. And the fourth one was applying the pressure with the thumb. So again, we're one thumb on, the other thumb on top, and to stabilise. Now I'd advise you don't do this one too many times in one treatment. Probably maximum is 2, but ideally you want to do it just once and hopefully you get the release on that. So again, I would work down the muscle 3 times in this case to get to the bottom. And a nice soothing one you can always finish with is both hands with the F large coming from the top, running the full length of the body, of the back rather, off to the sides and back up again. So the pressure is on the downstroke. As I'm coming down, I'm using my body weight through my arms till I get to the top of the pelvis, coming round and back up. So as I come back towards the head, I'm not really applying any pressure, it's all on the downstroke. And again, my fingertips are feeling the way. I'm not putting any pressure on the spine. So here's the spine. You can feel it there, either side of the backs of the facets. My fingers are running either side. You can see that as I'm coming down. So there's no pressure on the spine. I'm working on the muscles either side. These 2 fingers are the ones that are holding the most pressure. I'll show you that again. So look, there we go. And the others are guiding as it comes down. So you've got 4 or 5 simple movements there that can really help someone. Done on a regular basis, it should create a lot of relief.